So what is hip replacement?
A hip replacement is an artificial joint replacement of the hip joint. It usually has two components. So there's a component for the socket, which is called the acetabulum, and there's a component for the femur, which is the femoral stem, which goes into the femur or the thigh bone. These two articulate together and forms the artificial hip joint.
So why might I need a hip replacement?
Usually it is required for people with painful arthritis of the hip. One would know that if you had a lot of pain in the hip joint, which is actually felt in the groin, a deep-seated pain in the groin that limits your activity, causes you to limp, and quite often keeps you awake and is difficult to control with painkillers, is the sort of commonest indication where one would require a hip replacement.
So if I was going to have a hip replacement, what would I need to know before the operation?
You would need to know that it is a big operation, but it is a very, very successful operation on the whole. In terms of quality of life, it is probably second only to cataract operations. It has a few risks, but it is on the whole very, very successful in relieving pain. As long as you're having it done for pain, it is a very good operation.
How long does the operation take and how long might I be in hospital for?
The operation takes anywhere between an hour and 2 hours. You're usually in hospital for up to 5 days, sometimes a little bit longer, but most people get out even earlier than that these days.
And what do I need to know about after a hip replacement?
There are some restrictions that most surgeons would impose on their patients after a hip replacement. In particular, sitting on a low chair or keeping your legs crossed can result in a dislocation, which is a painful and unfortunate but rare complication of hip replacement. So that would necessarily need to be avoided. You're probably not allowed to drive for close to 6 weeks. Again, similar reasons, you're in a low seat and it is inadvisable to drive during that period of time. Your leg can be swollen, and this is again something to be aware of. If the leg swelling is also painful, then it's worth consulting your doctor to see whether that's a clot in your leg veins. Very rarely a hip can get infected or it can dislocate, as I discussed earlier, but these are all generally rare complications. It is on the whole about 90% to 95% successful.